This Focus on Health segment is brought to you by Aurora Healthcare.
Welcome back to Oshkosh Today. I'm Connie Carmical. You can hear Oshkosh Today on 101.9 FM and seen on CATV2 and City Cable 10. Today we are outside Aurora Medical Center in Oshkosh with Sheila Wyer. Just last year, Sheila would not have been walking outside the hospital. She underwent bilateral knee surgery. Basically, both of Sheila's knees were replaced by Dr. Cler, orthopedic surgeon here at Aurora Medical Center. In this segment of Focus on Health, we are going to learn more about this amazing surgery and how it can help people walk again without pain. Sheila, thanks so much for joining us on Oshkosh Today. Could you tell us a little bit about what life was like for you before you had the surgery?
My knees had gotten pretty bad. It was at a point where I couldn't stand through getting my dishes done. It was hard to walk up and down the steps that we have in our house. There's a lot of them. I found after I had it done that I didn't realize how much I actually couldn't do anymore.
So then after the surgery, how is life now?
Once I got out of the hospital, things took a turn right away. It was easier to walk, my knees weren't cracking, steps were a problem because of the surgery, but they didn't hurt like they used to. Things were a little slow going, but now we're climbing, we're walking. I can stand on it for half a day compared to before I was lucky to stand for 5 minutes.
Oh my goodness, the pain I guess was unbearable at times, huh?
Yes, it had gotten quite bad.
My goodness. Well, can you tell us, what would you say to other people who are thinking about having this surgery?
I think you yourself know when the time is right to do it. There's a lot of things that you can go through that you can try to make it better, but when it gets to a certain point, your best thing is to just get it over with and not wait, because it does make a big difference.
And you were telling me earlier, before we did this interview, you were telling me a little bit about some research you did. Would you recommend that before people have this surgery? Like make phone calls or to people who have had this surgery in the past? And
that's what I did. It was one of those things I wanted to research. One of my friends said to me, do you want quality of life or not? And that really got me to thinking. Then I started calling people. I called strangers to find out what they had done, what it took, and what I was in for.
Well, and Dr. Cler, he's a great doctor, and we're going to go into his office now and meet up with him.
Okay.
Okay? We are now in the examining room, and joining me is Dr. Cler and Sheila. And Dr. Cler, thanks again for joining us.
You're welcome.
Why don't you walk us through the surgery and where it takes place, or how it takes place, and what happens on the operating table?
Okay, I've got a model here of what a total knee replacement looks like. Basically, once we're in the surgery, the first thing we do is open up the knee. We're trying to do as small incisions as possible, and we've got fairly small. Sometimes they're smaller, sometimes a little bit bigger, but whatever it takes to get in there and do the job. Once we open up the knee and clean things up, the next step is to go ahead and do the cuts. This is what a knee replacement looks like. It's actually, if you look at it from the side, this is the only part of the knee that we're changing. This is all part of you still. The ligaments that hold the knee together at the start are still what holds it together at the end. All we're changing is the surface. So we need to cut the ends of the bone off, about this much of this, about that much of the bone on this side, and about the same on the other side, and replace it so that instead of walking bone on bone, they're now walking metal on plastic. The old way of doing it, and the way a lot of people still do it, is the first thing they would do is after they got in the knee, they would drill a hole in the leg and run a rod up, and then they'd put a cutting jig such that when we're all done with it, the bone is cut much like this. Well, what we do instead, and I think it's a much, much better way to do it, is instead of putting that rod in with the jigs, we go ahead and put a couple pins in the leg. I think Sheila's got a couple little scars on the outside. Those pins have computer arrays on them, and the computer sees that. And we educate the computer. We show it that where the the surface anatomy of the leg. We show it what the knee looks like exactly, show where the ankle is, show where the hip is, so that when we're done, the computer knows exactly what that leg looks like. It's more of a custom job. And after that, all the cuts that are made, all these little cuts that we have to make are done according to how the computer tells us to do it.
That's amazing. Now, why was Sheila such a good candidate for this type of surgery?
Well, even though she's a little bit young, she had undergone all the conservative treatment. Both knees were worn out. There was no cartilage left in them. But she had gone through all the anti-inflammatories, different kind of medications, shots. We even did arthroscopies to try and clean it up. And despite all that, her knees were really getting in the way of her life and being able to do things.
And I'm just curious, how do you determine that you're going to have to do this surgery? What do you have to do prior to that?
Well, basically x-rays will show how bad the arthritis is. And even though a patient has really bad arthritis and their knees are completely worn out, doesn't necessarily mean that they should undergo a replacement right away. We want to make sure that they go through all the conservative things, again, the shots, the anti-inflammatories, glucosamine, things like that. And when all that fails, then it's time to do it.
Okay. And can you tell us what are some of the advances in knee surgery here at Aurora and the patients and physicians can take advantage of?
Well, as you've seen on pretty much every TV and billboard and everything else, there's a lot of hype about different knees and things, and we try to rely basically on studies. Show me data that says that why I should use this knee or that knee. The knee that we use is called a rotating platform knee. It actually goes back, all knees go back and forth. This one allows rotation. That's a more natural motion. And this particular design has a 20-year follow-up. At 20 years, 90% of the knees are still in. So that's why we use it. It's a knee that's proven to work, and it does a great job.
And do you recommend having both knees done at the same time if you're going to have them done anyway?
I try to talk people out of it. I try to talk Sheila out of it as well. And I tell them that basically it leaves you without a leg to stand on, literally. But some people are excellent candidates and want to really move faster, and in those cases, like Sheila's, we were willing to go ahead and do both at once, and she did really good.
So it depends on the patient.
She was going to prove me wrong when I told her that we should do them separately.
Well, I'm very impressed. I mean, I didn't even know, I would have not known that she had knee surgery just looking at her, because I can't believe how thin the scarring is on there. And I was talking to her earlier, and she feels great, and that's wonderful. Well, thanks so much for joining us.
You're welcome.
For more information about knee replacement here at Aurora Medical Center in Oshkosh, you can call 456-6000. You can always log on to Aurora's website at aurorahealthcare.org. Thanks for joining us on this Focus on Health.
This Focus on Health segment has been brought to you by Aurora Healthcare.